that, I think I'm going to take off my jacket. Get a little more relaxed here. Part of the reason we came to Tennessee, in addition to me just liking Nashville and liking
President Obama in Nashville, Tennessee.
President of the United States, accompanied by Kelly Bryant.
And I am truly, truly honored to welcome him here to our great city of Nashville, Tennessee. Ladies and gentlemen, our President, Barack Obama.
My presidential motorcade. Which I thought was pretty cool. Well, it turned out it was so close to the school. We said, well, we might as well just swing by and get her. I want to thank the school for hosting us here today, because I know it's a lot of work when we come into town. I very much appreciate everybody who was involved with that. You have a great mayor, Carl Dean, who's here. So please give There's beautiful family right there. Family, stand up, family. Well, there's his family. You can't imagine what a family has to put up with when you're in public service. So we really appreciate all of them. Kelly already mentioned him, but he is somebody who is what you want out of a member of Congress. He works hard, he calls it like he sees it, he's willing to do courageous stuff even when it's not popular. He is a gentleman, one of my favorite people, Jim Cooper. Also, here's somebody who knows healthcare well, was a healthcare professional, a doctor, and executive, and knows a little bit about politics because he used to be the former majority leader. When I first came in fact, he and I had a chance to work together on a number of things. He's been a terrific advocate on behalf of healthcare for a lot of people. Mr. Bill Frist. So with that, I think I'm going to take off my jacket. Get a little more relaxed here. Part of the reason we came to Tennessee, in addition to me just liking Nashville and liking the state generally, thank you, is that Tennessee has a history of innovation when it comes to healthcare. Doing some very creative stuff. Healthcare professionals, doctors, nurses, hospitals, and executives working alongside nonprofits, and public sector to make sure that people are getting the very best healthcare they can, and also being able to control costs in a sensible way. And thanks to the Affordable Care Act and the efforts of people like Jim, who took some very tough votes, we now have about 166,000 Tennesseans who have health care who didn't have this law, even though a lot of folks don't know it. So if you have health insurance through the job, you're able to keep your child on health insurance up until they're 26 years old because of this law. And that's provided millions of young people across the country with health insurance that they never had before. And that's especially important as young people are transitioning, getting their first job. They may not always get a job that has full benefits. In this way, they're able to make sure that they stay healthy. In addition, if you're a senior citizen or somebody who's disabled, it turns out that you are getting discounts on your prescription drugs that you may not have noticed, but are saving you potentially hundreds or even thousands of dollars, and there are millions of people across the country who are benefiting. That is because of this law. If you don't fall into those categories, you're just somebody who's got health insurance on the job, you now are protected so that if you, let's say, lost that job or decide to move to a job or to start your own business, you can't be prohibited from getting health insurance because of a pre-existing condition. That's a protection that everybody is benefiting from. So, if you're a woman, you can't be charged just for being a woman as a consequence of this law. Last I checked, that's about over half the population, so that's a pretty large constituency. You're able to get free preventive care, including mammograms, as a consequence of this law on your insurance. So there are a whole host of things that fall under the Affordable Care Act that are benefiting 100 million, 150 million people. They just may not be aware of it. But what it's done is it's made healthcare stronger, more secure, and more reliable in America. You don't always notice that until you need it, the way Kelly needed it. And that peace of mind, that understanding that if you get sick, you're not going to lose your job, or you're not going to lose your house, you're not going to lose all your savings, that you're going to be able to get quality care. That is extraordinarily important. I've said before, the scariest day of my life was when Sasha was 3 years old, 3 months old, my daughter, and she got meningitis. And the only reason we knew was because we had a great primary care physician, and we were able to rush to an emergency room. And the doctors and nurses did extraordinary work. And I was feeling helpless in that situation, but I thought, what would happen if I was in the same situation and I didn't have health care? And I didn't have a primary care physician to call in the middle of the night, because we noticed that she wasn't crying the same way she usually cried. Because of the law we passed, there are parents who just aren't going to have to face that. And that's priceless. Now, the good news is that, contrary to some of the expectations, not only has the law worked better than we expected, not only are 16 million people now getting health insurance that didn't have it before, not only do we now have the lowest uninsured rate since we started tracking people and how much health insurance they had, but it's actually ended up costing less than people expected. And healthcare costs have been held, the inflation on healthcare costs has actually proved to be the lowest since the Affordable Care Act passed in the last 50 years. So we're actually seeing less healthcare inflation, and part of the reason is because the law also encouraged healthcare providers and doctors, nurses, hospitals to start thinking more creatively about how can we get a better bang for our healthcare dollar. How can we make sure that rather than spending a lot of money on unnecessary tests or readmissions, we're encouraging really high quality care that's good for the patient, but also good for healthcare spending. And this is another area where Tennessee actually has been really innovative. In fact, it won a $65 million grant for state innovation, where you've got hospitals and doctors and nurses and non-for-profits and other groups working together to figure out how can we, for example, identify potential diabetes patients early, make sure that they're getting healthy quicker, preventing some of the worst elements of it, and even though it might involve a little extra spending on the front end, it turns out it saves hundreds of thousands of dollars on the back end. Improves quality of life, improves quality of care, cuts costs, which is good for our economy, good for patients, and good for America. So I'm feeling pretty good about how healthcare is going. And the thing I've never lost sight of, though, is that this is about people. This is not about politics. It's not about Washington. It's about families and loved ones and the struggle and fear that comes about when you have a serious illness, and knowing that you've got not just your own family, but also a community that has your back. And, you know, you heard Kelly talk about her story. Sitting right next to Kelly is a wonderful woman named Toma Canfield, who came down with me today. She's from Ohio, and she wrote a a letter to me, pretty similar to Kelly's, back in 5 years ago, so back in 2010, when we were still in the middle of this fight, to try to get health care that's affordable for everybody. And Natoma had been diagnosed with cancer, had beat it back, then was buying health insurance on the individual market. It turned out that the costs were just skyrocketing so high that she just couldn't afford it anymore. And she wrote to me a passionate letter about why we needed to get this done. And I would always refer back to her letter whenever things got a little bleak and Congress wasn't behaving as sensibly as Jim Cooper behaves. And when we finally signed that bill, I had Natoma's letter framed with the pen that I signed the bill with, one of the pens that I signed the bill with, just to remind me that this wasn't about politics, this was about people. And so I'm so glad Natoma's here, but I'm also glad that all of you are here. And part of what I'm hoping is that with the Supreme Court case now behind us, what we can do is ultimately what we can do is now focus on how we can make it even better. Because it's not as if we've solved all the problems in our healthcare system. America still spends more on healthcare than any other advanced nation, and our outcomes aren't particularly better. And so we know there's still a lot of waste in the system. We know that the quality of care isn't always where it needs to be. And so my hope is that on a bipartisan basis, in places like Tennessee, but all across the country, we can now focus on what have we learned? What's working? What's not working? Are there further improvements we can make to improve quality? Are there more ways we can encourage people to get preventive care so that they don't get sick in the first place? So that we have an actual health care system instead of a disease care system? Are there ways that we can do better to provide the support we need for outstanding primary care physicians and nurses who oftentimes are coming out of school loaded up with debt and aren't always getting the support that they need and aren't always able to practice the way they want to practice? There are huge areas of improvement, and frankly, there's still a lot of people who aren't insured. Part of the design of the Affordable Care Act was that some people were going to buy health care on the marketplace. In some cases, we were going to allow states to expand their coverage through individualized programs in their states. I think because of politics, not all states have taken advantage of the options that are out there. Our hope is that more of them do. We still have to sign a bunch of people up. We've covered now about a third of the people who weren't covered before this law passed, but it means there's still 2/3 out there who still need some help, and they're still going to the emergency room at the last minute when something goes wrong. And so we want to educate people, we want to listen to folks, we want to hear good ideas from all sources. We want to think about this in a practical American way instead of a partisan political way. If we do that, then I think there's still great strides to be made. So I want to thank all of you for being here, and with that, I'm just going to open up for a bunch of questions. And you can ask me about anything, but probably you should ask me a couple of questions about healthcare. I'm also willing to talk about the women's soccer team and how we're going to beat whoever it is we're playing on the team. Talk about the NBA free agency. I'm just going to call on folks. The only rules I'm going to lay down are when you raise your hand, if you can wait, are there microphones in the audience? So wait for a microphone so we can all hear you. And I'd like you to introduce yourself. And I'm going to try to make sure that we go boy, girl, so that it's even. Okay? All right, we're going to start with this young lady.